Using single leg stance as an objective measure here, look at Jared's patella on the left side. Look at his kneecap. You can see he stands wonderfully on that left side. Standing on the right, look at the movement of the patella. You can see the femur internally and externally rotating, bit of collapse at the foot. So what are we going to do with this? Well, because Jared has a history of FAI, femoroacetabular impingement, what I've done here is got Jared to do some proprioceptive walking with the weight on the left side because his problem's on the right leg. So when on support stance, it's having to work very hard to be able to reflexively control his body. Well, of course, I screwed up the video and I've only got a photo of this, so I'm going to show you how Danny demonstrates the proprioceptive walk. So here, Danny, imagine that she has a problem on her left hip and the weight's on the right and it's moving all around, walking backwards and forwards, basically helps setting up better reflexive control of the joint. When you look at the hip joint, it's a very nice, tight and stable joint. Stability over mobility for hips. You can see how the femoral head sits into the acetabulum there. If there's irritation of the joint, this can inhibit muscle function. So if you have a look at a lot of the big superficial nerves that are sitting around here, there's a lot of little nerves that sit around the joint itself. So that's what happens with the feedback. Now, retesting after our proprioceptive walk, Jared, I'll get you to stand on that right leg and you can see immediately so much more stability. Proprioceptive walk for FAI.